My name is Lindsay Smith and I'm a researcher and a clinician in the Bristol area of England. I am supported by the National Institute for Health Research. My interest is in hip replacements, which is when people with end-stage arthritis in the hip joint have an operation to replace that joint with man-made components. In the UK, in the NHS, we have about 100,000 people per year having a new hip joint put into place. Many of these joints are very successful in relieving pain and provide the patient with a lifetime of activity. However, approximately 10% of these joint replacements will fail during the lifetime of the patient and will need to be redone. The British Orthopedic Association and other similar associations across the world provide information and guidelines for the follow-up of hip replacements. However, there are many institutions where these guidelines are not followed for various reasons. So we undertook this particular project in order to be able to have a look at the international orthopedic literature to find out whether there was any evidence for the cost effectiveness or the clinical effectiveness of the long-term follow-up of hip replacements. We conducted a systematic literature review using PRISMA guidelines and a pre-published search strategy. 2 researchers were involved in extracting all the data and a 3rd researcher was involved in the qualitative expertise needed to analyse the text that we extracted. We screened over 4,000 articles to get down to the final 114 that were included in our review. These represented a range of countries, 22 different countries, and many of the studies were observational studies. This is inevitable because with a long-term follow-up, it is very difficult to do any other type of study, and indeed one of the studies was out to 27 years. The data that we extracted indicated that there was a broad support for follow-up in many ways, and in particular for those hip replacements where the outcome of the construct was unknown or for specific patient subgroups. So, our conclusion when completing this study was that although there is a lack of evidence to support the economic aspects of a long-term follow-up service, there is obvious support for this type of service, and in particular for certain subgroups of patients for whom there is a very obvious long-term benefit.